Sickle cell disease etiology of pathologic condition. Sickle cell is and what damage it causes to the human body. The function of SCD and history. A U.S. chemist, Dr. Linus Pauling, was born in 1901, and in 1949, he was one of the influential inventors in molecular genetics, as well as Dr. Linus Pauling. He was born in 1901 as well. They were both one of the influential events of the molecular genetics, but when Mr. Pauling was working at California Institute of Technology, he discovered the weakness in the hemoglobin molecule blamable for the condition. This change in the molecule malformed its electric charge. The etiology of the pathologic condition. According to patient information, the cause is inherited. It's in the genes from your parents. It is a change in the genes which tell the body how to make the important protein called hemoglobin. To get SCD, you need to have two altered hemoglobin genes, one from each parent. If you only have one of these genes, you will have sickle cell trait, which is very much milder. Here you could see in the diagram of the mother and the father having the traits. If one, like the mother, has a trait, but the father does not have the trait, the offspring will have a mild trait of sickle cell. If the father has the sickle cell and the mother doesn't, same thing. But if they both do, the chances for the child is higher and greater for them to be able to have SCD. The effects of the organ system. Lungs are a main organ affected by sickle cell disease. Those with sickle cell can have asthma and pneumonia, and occurrences where the bloodstream is cut off to the lungs, or there is a contagion, acute chest disorder can develop. So it can be very, very dangerous. That's why people who have sickle cell, they need to be watched continually and monitored, and to make sure they're breathing well, and that if they do, they need to go to the hospital right away, because it is very dangerous. This conclusion is that this disease has distressed approximately 1 million of 3 million people in the United States, and tormenting patients throughout Africa as well. When a chemist at California, Pauling, as I mentioned earlier, at the Institute of Technology, when he discovered that in 1949, the scientists and patients alike, to help understand the organs and etiology and the pathological condition. And the SCD molecule is a corporate for the state of this disease, whereby this change in the molecule malformed its electric charge. It was found in the flaw in the hemoglobin in the particle. Lastly, the disease does have a direct and sometimes a severe effect to the heart and lungs. Sickle cell disease symptoms and treatment. The purpose of this narrative is to identify CSD. We will explain in detail the symptoms, treatment, and managing pain for the human body for this disease. Treatment for sickle cell patients. Treatment involves getting repetitive tests to monitor health, handling pain events, emergencies, and handling related health complications as they arise. Treatment for children. When parents learn that their infant has sickle cell illness, it's the beginning of the enduring education development for them. Conscience as much as you can about the sickness can help you control warning signs as they arise and know what to do in crisis conditions. Routine childhood infections, shots in adulthood, are important too. Daily antibiotics from 2 months to 5 years are aged to counteract life-threatening illnesses. This run through stops at age of 5 because older children don't have as many acute pathogens. The medicine uh, hydroxia multivitamin increases with iron during childhood. Uh, Folic acid increments daily. Protein supplements if there is a lag in weight increase. You need to monitor the treatment as well. That's very, very important. According to WebMD, routine tests includes complete blood count, the urine test to monitor the function of organs, test to check for vision problems, test for hepatitis C infection, and frequent blood transfusions are given. Sickle cell disease treatments overview, MD. Managing the pain of sickle cell. Any aching not well ordered by 2 tablets 4 hourly is carefully reasonable plan, and we then set up to morphine. Measured discharge oral morphine required 12 hourly is used for long term numbness with smaller amounts of quick discharge oral morphine for development of pain. Our conclusion is when Mr. Pauling was working at the Institution of Technology, he discovered that the symptoms may include growth impedance of the infant's early stage, delay in secondary sexual change, leg ulcers, fatigue, ocular irregularities, gallstones, and a stroke. When parents pick up their child has sickle cell illness, it is starting of a lasting learning development, where as much as you can about the sickness can help you handle warning signs as they arise and know what to do in the crisis of illness. Parents and adults shall be very mindful to follow strict instructions for daily dose of medicine to manage the pain that they or their children have or will endure for a lifetime.